The Community Memorial Health System Fall 2021 Speaker Series Online is brought to you by Mission Home Health. Mission Home Health and Hospice is committed to taking care of people by providing the highest quality, cost-effective care wherever the patient calls home. With over 14 locations, Mission delivers skilled home health, hospice, and palliative care services to more than 3,000 patients a day. As a preferred partner with several health systems, Mission works with providers to customize each partnership to provide exceptional coordinated care. Visit our website to learn more at www.homewithmission.com. We take care of people, and one call does it all.
Hello. Thank you so much for joining us this evening for our Speaker Series online presentation. My name is Deb Lawry, and I'm a registered nurse nationally certified in oncology. I'm currently the Community Memorial Health System's Cancer Patient Navigator, and I work as a part of the system in the Cancer Resource Center. I will tell you about our Cancer Resource Center a little bit later in our program. We have an excellent and informative presentation for you all this evening, and I'm so very glad that you're here to join us. But first, a little housekeeping. As with all presentations, we are able to accommodate questions from the audience, and you will enter your questions under the Q&A section on your screen. You do not need to wait till the very end of the presentation to ask your question, but as they crop up in your mind, feel free to enter them at any time. At the end of the presentation, we will address as many questions as we can get to in the time that we have left. So tonight we are joined by Dr. Allan Wagner and Ember Layton of Genetic Center. I thank you both for coming to join us this evening. And what we're going to be talking about tonight is cancer prevention measures that can be incorporated into your everyday life. We'll also discuss the role of genetic testing and how that maybe plays out in assessing your risk for cancer coming into your life at some point. So really a lot of information. And again, feel free to answer questions or to ask questions as we go through, and we will address them later. Our first presenter of the evening is Dr. Allan Wagner, and Dr. Wagner is currently seeing patients at Midtown Medical Center in Ventura. Dr. Wagner received his undergraduate degree in human nutrition from Ohio State University and is passionate about preventative health care. He received his doctorate in osteopathic medicine from Midwestern University and completed his residency training right here at Community Memorial Health System. Thank you for joining us this evening. We're very honored to have you tonight.
Thank you so much for the introduction. Thanks for having me. All right. So to start things off, I'm just going to talk a little bit about what is cancer. We hear the word cancer thrown out there a lot, and it can mean a lot of things. So just a general overview, your body is made up of trillions of different cells, and throughout your lifetime, these cells grow and divide. And usually when abnormal cells pop up, there's processes in place that can take care of that to get rid of abnormal cells. But sometimes something can go wrong during this process, and that's where a cancer can develop. So there's many different types of cancers that we see, and they're often named for which part of the body that the cancer started or is affecting. And we'll kind of get a little bit more into that later. So you might be wondering, well, what exactly causes cancer? What are some of the things that I can do to prevent cancer? So that's what I'll be talking about here. Briefly giving some information as to what we can do throughout our lives. What sorts of lifestyle changes can we make to help prevent or reduce our risk of having cancer? And just sort of give a general understanding of cancer. So moving right along here. Cancer in the United States, we all know someone who's been affected by cancer. It's estimated that about 1 in 3 people in the United States will have cancer throughout their lifetime. So we all have a family member, close relative, somebody who's been affected by cancer. And so it's really important to navigate how can we best prevent it, how can we minimize our chances of being affected. Some of the most common forms of cancer that we see are lung cancer, prostate cancer, breast cancer, colon cancer, skin cancers, bladder, uterine, blood, kidney. All different body systems can be affected by cancer, and that's what makes it so challenging as well. All right. So there are many things we can do to help minimize our risk for cancer. One of the most important things that we'll touch on first is tobacco use, and in particular smoking. So smoking is the leading cause of preventable death. What we mean by that is by not smoking, we can reduce our chance of many health-related illnesses such as cancer. We can reduce things like the number of colds we get. Over time, smoking can predispose us to other conditions such as COPD or breathing problems. And so smoking is one of those things that is very easily preventable and can help to save a lot of health issues. And there are a lot of benefits to quitting smoking, not just your health, but also the health of those around us. Secondhand smoke exposure can lead to risks for cancers for our family members, those around us, our loved ones. And also, quitting smoking can lead to saving lots of money. Tobacco is not cheap, and certainly the packs of cigarettes can add up. And other things that we also take into consideration when we say tobacco and smoking is e-cigarettes or vaping. Those things also have risks associated with them and would fall into this category of preventable ways to reduce your risk of cancer. Other ways that we can reduce cancer risk would be protecting ourselves from the sun. So living in sunny Ventura, of course, that is one of the things we worry about. We spend a lot of time outdoors at the beach. We're very fortunate to have great weather year round, but all that sun can catch up to us with sun damage. So there are a few different kinds of common skin cancers you might have heard of. Melanoma is one of the big ones that you might have heard of. There's also ones called basal cell carcinoma, squamous cell carcinoma. And these are also preventable by minimizing our exposure to the sun through things like sunscreen, staying in the shade, wearing protective clothing. All of these things can help to minimize that UV radiation from the sun and reduce the damage to our skin and help to prevent skin cancer. It's also important to take into consideration what season it is of the year. The UV rays can have different strengths during the different summer season versus winter, for example, and also being exposed at different times during the day. So the UV rays tend to be stronger when it's in the afternoon when the sun is out. So kind of keeping into consideration these things when you're planning your day-to-day activities or trips to the beach are really important. And of course, there is other risk factors such as family history and those things that play a part into skin cancer as well. But the biggest thing you can do is to try to wear your sunscreen anytime you're out in the sun to prevent that UV exposure. All right. Other ways that we can work to prevent cancer and to make ourselves have a healthy, long life is diet, exercise, and focusing on our body. So research has shown that poor diet and sedentary lifestyles are risk factors for cancer as well. So one study by the American Cancer Society showed that 18% of all cancers diagnosed in the US are related to excess body weight, physical inactivity, excess alcohol consumption, and or poor nutrition. So a lot of the choices that we make every day with regards to our diet, what we eat, how much exercising we're getting, all of these things can play a factor into our overall health and cancer risk as well. So one of the areas that we focus on is our weights. And there's something called a BMI, which is a rough estimate of kind of where we stand. It takes your height and your weight into consideration and helps us to form sort of an objective measurement of where you stand. And being overweight with that has shown to lead to increased risk for several cancers such as breast cancer, colon cancer, liver, and kidney cancers. So staying on top of your weight, closely monitoring that is always a key role in preventing cancer as well, and can also help to prevent other diseases like high blood pressure, diabetes, and other health conditions as well. So touching a little bit more about that with physical activity. Physical activity is something we encourage for all of our patients, not just to prevent cancer, but for good cardiovascular health benefits. And so you might be wondering, well, how much should I be exercising? What's enough? And so right now, the American College of Cardiology, they have some recommendations set out for us, and they say we should strive for about 150 to 300 minutes of moderate intensity activity. So what exactly does that mean? That means walking at a brisk pace, jogging, cycling, going on the elliptical, those sorts of things that get your heart rate above your resting heart rate are great ways to get exercise. And then as an alternative, they say about 75 to 150 minutes of vigorous intensity activity each week. So that could be like running, maybe you're rowing, or doing something really where you're exerting yourself, breaking a good sweat, getting that heart rate up. All right. And then talking about nutrition, of course, that's a key role as to how we define our health. You might have heard of the phrase, you are what you eat. And with my background in human nutrition, this is something I've always been interested in and try to help my patients with. A healthy diet is one of the cornerstone things of good health. So what do we mean by what's a good diet, or how do I eat well? Well, there are a few simple things you can do without going on any diet plan or anything like that. And just basic things that can start at the grocery store. So avoiding processed foods. If you're going shopping and you're looking at the label and there's many different ingredients and you can't pronounce them or you don't know what that is, then that food might be processed and it might be refined, and there might be a lot of additives, sugars, and things. And to just try to avoid that, focus on eating fruits, vegetables, lean meats. Those sorts of things are great, easy ways that don't take a lot of research into doing, but are simple ways that you can improve your diet. Other ways that we can work on improving the diet are decreasing our sugar-sweetened beverages. So it can sometimes be deceiving how much sugar is in, say, for example, a glass of juice, or that Starbucks drink that you get, the latte. A lot of those things can have a lot of hidden sugar in them, and over days and weeks, those extra calories can add up. So avoiding sugar-sweetened beverages like sodas, even cocktails or alcoholic drinks can have a lot of sugar. So just keep that in mind when you're going through the grocery store. And then finally, there's been some studies that show that a lot of red meats or processed meats can be linked to certain cancers as well. So that's something to avoid. Focusing on lean proteins, fish, those sorts of things are easy changes we can make to our diet. Right. Next is alcohol. This is another easy way, another very preventable thing we can do. So alcohol consumption can increase your risk for several different types of cancer, and there is a correlation between how much alcohol you drink and the risk for your cancer. So in general, men should drink no more than 2 alcoholic beverages per day, and women 1 alcoholic beverage per day. And this is just another easy way to also save on calories. Alcohol is another hidden source of calories, and oftentimes the alcoholic drink you might be drinking could have sugars added with it, and it might not have on the label how many calories are necessarily in there. So you can save on calories and also reduce your risk of cancer by avoiding heavy alcohol use. All right, so one of the things that we've noticed in that outpatient clinic setting is that throughout this COVID-19 pandemic, there's been a large decrease in cancer screenings. So one of the takeaway points that I would like for you viewers at home to take away from this is that cancer care and cancer prevention can be very individualized. And so it's important to talk to your doctor to discuss which cancer screenings are appropriate for you. It would be sort of out of the scope of this presentation to talk about each and every form of cancer screening and to go through all of them. So really having a sit down with your doctor, schedule that physical, talk to them about which cancer screenings are appropriate for you to help reduce your risk of cancer. And on top of that, the things that we talked about, having a healthy diet, regular physical activity, cutting back smoking, avoiding sun exposure, all of those things can also help to reduce our risk of cancer. And it's just important to know that cancer screenings can just vary based on your age, your past medical history, your family, and your genetic risk factors, which we'll talk more about here shortly. So really encourage you to follow up with your primary care doctor and have a good discussion about which cancer screenings and other ways you can help prevent cancer to live a long, healthy life. All right.
Great.
Thanks, Deb.
Dr. Wagner, thank you so very much. You gave us a lot of helpful, useful information and some easy ways to make some changes that might benefit us in the long run and help us to lead long and healthy lives. Thank you so much. And so our next presenter, I am pleased to present Ember Layton. She joins us from the Genetics Center. Ember is a licensed and certified genetic counselor who specializes in cancer and prenatal genetics. Ember received her undergraduate degree in biological science from California Polytechnic State University and completed her Master of Science in Genetics Counseling at the University of California, Irvine. So Ember, thank you so much. We look forward to hearing what you have to tell us.
Thank you. Thank you for having me today. So as she said, my name is Ember and I'm a genetic counselor, and I'm sure many of you at home have never heard of genetic counseling before. So I just wanted to give you a little intro about what that is. So genetic counselors like myself, we are not doctors. We do go through a master's program specifically in genetic counseling, and we are an important part of the healthcare system. We meet with individuals before and after genetic testing, and there's a lot of areas that we can specialize in. And as she said, mine happens to be cancer genetics and prenatal genetics. So for cancer genetic counseling, many of the reasons that people will come to see me are because a personal or family history of cancer. And that's because many types of cancers do have a hereditary link, meaning that there's an inherited risk for getting that cancer. And I specialize in talking with these patients and families and helping them understand that risk. Now, cancer, unfortunately, is a very common condition. Everyone has a lifetime risk of developing certain types of cancers. So, for example, breast cancer, our lifetime risk is for women of developing breast cancer is about 12%. Ovarian cancer is about 1 to 2%. And for men and women, colon cancer risk is about 6%. Now, most of these cancers are going to be sporadic, happening just by chance, but a small portion, about 5, maybe 10% of these cancers are inherited through a family because of a genetic change. So the clues that we want to look out for in terms of determining if someone might be at risk are these here. We have cancer in 2 or more close relatives of a family. Cancer diagnosed earlier than expected. For example, breast cancer prior to 45. Someone who has multiple tumors or might have bilateral cancer in both breasts. Cancers that are seen together, like breast and ovarian, or uterine and colon, or individuals who are of high-risk ancestry groups like the Ashkenazi Jewish population. This slide here is trying to demonstrate the difference between sporadic cancer and one that would be more suspicious of a hereditary cancer. The family history over here, we see only one person diagnosed with cancer, and that cancer is diagnosed later in life, compared to the other side, where we see cancer in every generation, with cancers that are related to one another, breast and ovarian, and cancers that are diagnosed at young ages. So before we go further, I did want to kind of take a step back and go over some basics about genetics, about inheritance, so everything's easier to understand. So our genes, which are found in all of our cells, basically provide the instructions to tell the body how to grow and how to function. And each gene has a very specific role. If there's changes to this genetic information, then that can lead to genetic disorders. Now, this list here is a list of different genes that we know to be associated with an increased risk of developing breast and ovarian cancer. So we can see here are what we offer as our breast cancer panel and our ovarian cancer panel. Of these different genes, BRCA1 and BRCA2, they are the biggest culprits, the ones most often responsible for inherited breast and ovarian cancer. Over here, for hereditary colon cancer, Lynch syndrome is the biggest culprit, where there's actually 5 different Lynch syndrome genes. The interesting fact is that we all have these genes. Everyone does. And the question is, are they working or not? These genes are responsible for regulating the cell, making sure it's growing, dividing correctly. If there is a mutation, that will prevent the gene from working correctly, and that's what puts a person at increased risk. Here we see an example of sporadic cancer versus inherited. Sporadic cancer, someone starts off with all healthy cells, no mutations, no issues. Even though that cell is being regulated correctly, down the road, little errors can eventually slip through the cracks and a cell can become cancerous. But with hereditary cancer syndromes, that person has inherited a mutation from one of their parents. It's in all of their cells. And because it impacts regulation, it's a lot easier to accumulate all of these errors and for that cell to eventually become cancerous. So as I mentioned, these mutations, they are inherited through a family. So if a person has a mutation, they will have a 50-50 chance of passing it on to their children, okay? Now, if someone is interested in doing genetic testing and they meet with me, they meet testing criteria, we can order that genetic testing either through blood work or saliva. What the lab does with the blood is they analyze the genes of interest through a process. Technically, it's called sequencing and deletion duplication analysis. But basically, they're spell checking the gene, looking for any issues. There can be different types of results that we can get. Positive results, negative results, and another category called a variant of uncertain significance. The one I'm going to talk about first is a negative result, because that's what we hope for. And honestly, that's what most of our patients come back with, is a negative result. So for an example, a patient being seen because of a family history of cancer without any known mutation in the family, their cancer risks with a negative result aren't fully defined. And that's because there's still an unexplained cancer in the family. We don't know why that is. So we just want to screen that individual based on what we're seeing in the family. So we would either do that if they have either an average risk, or if we determine that they have a moderate risk of developing cancer. So for breast cancer, if we go here, that average risk is, we'll see someone doing mammograms starting, let's see here, there we go, beginning at age 40 versus someone who might still be at an increased or moderate risk. We want to do consider mammograms and breast MRIs 10 years prior to the earliest age of diagnosis. If someone has a family history of colon cancer and their testing is negative, if they are back at average risk, we want to start colonoscopies at about 50. But if they're still at increased or moderate risk, we want to do that at age 40 or 10 years prior to the earliest age of diagnosis. We might also get positive results. In that scenario, we would know that a person would be at increased risk. And what that risk is all dependent on what gene the mutation is found in. Each gene has its own set of risks, what cancers are associated with, and what level that risk is at. So these next slides just kind of focus on the main ones with BRCA1 and 2 and with Lynch syndrome. So you can see here on this slide, individuals who do have a mutation in BRCA1 or 2 are at a significantly increased risk of developing breast cancer as high as 87%, an increased risk of developing other cancers like ovarian, prostate, pancreatic, and male breast cancer. One of the things I want to point out here is that risk is not 100%, so it's not guaranteed that a person will get cancer, but it is at a higher risk. So for these individuals, we want to screen them a lot more closely, and we follow guidelines from NCCN, National Comprehensive Cancer Network, on how to do that. So with breast cancer screening, for example, these individuals would have screening much earlier on. So at 25, we would start with breast MRIs and then add in mammograms at age 30. So the reason for doing all of this is that if there is a cancer going to develop, that we catch it at an early stage when treatment is a lot more effective. We might also have option of preventative measures, preventative mastectomies, for example. Over here, this is an example of the risk associated with Lynch syndrome. And we can see a significant risk for not just colon cancer, but uterine cancer, ovarian, other GI cancers, brain cancer, etc. So we'd want to make sure that they have the appropriate screening too. So as an example, colonoscopies would start at between 20 and 25 rather than waiting until 40 or 50. When a person comes back with a positive result, it is a lot to take in, but we hope that that information that we can give them is empowering, and we can get them the best care so they can mitigate that risk. The other type of result we can get is a variant of other uncertain significance, where we just haven't seen that genetic change before or enough times to really know what it means, to know, is it benign, just part of what makes you unique, or is it associated with an increased risk of developing cancer? So for these individuals, we screen based on their family history again, and we just wait until the science and the literature catches up and we can see what that change means down the road. So just like science is changing, family histories change too. So everything is important to keep your doctor updated on. If there's been a change in family history, a new diagnosis, our patients would be encouraged to let their doctors know, and even to check in and see if new testing is available. Years ago, we were only testing BRCA1 and 2 for breast cancer risk. Now we have much more comprehensive breast cancer panels. So that's my time. I want to say thank you. I hope that I was able to give you some more information about hereditary cancer, genetic testing, and the information we can do with that. Thank you.
Amber, thank you so very much for all of that information. I'm sure that a lot of people have a lot of questions about that, and this is a great resource for them to get started with who to ask and how to ask their questions. So, my name is Deb, as I mentioned earlier today, and I do want to thank both of you. That was just wonderful information. Before we go to the Q&A session, I just wanted to talk a little bit about the Cancer Resource Center. It's a supportive center that is supported by Community Memorial Health System, and its whole goal is to support patients as well as their families on their journey through cancer. I am an oncology nurse. I work with a licensed clinical social worker, and together we kind of walk the patient and their family through their journey with cancer. We are a source of support, a source of information. I can always point you in the right direction. If you have questions that you need to have answered, we're the place for you to call. As far as our genetics talk and our risk factor talk here today, we are going to be able to offer patients a screening questionnaire that we can pass on to Ember at her facility. And if it is indeed looking like that you might have some genetic risk factors, then certainly we can plug you into getting some testing done so that you can understand whether or not you're at a higher risk, you're not at any more greater risk than the general public. But we have a source for you to ask your questions. So if you give us a call at the Cancer Center, which is at 805-948-5459. The information is on this slide as well as my email. I am happy to discuss that with you and point you in the right direction. So know that we're there. Let your family and friends know that we're there just to support you. Our services at the center are all free of charge. So at this point, after that wonderful presentation, it's time for our Q&A session. And the first question goes to you, Dr. Wagner. Do vaccines play a role in cancer prevention?
That's a great question. Thank you, Deb. Absolutely. Vaccines do play a role in cancer prevention. There are certain types of cancer and certain vaccines that we focus on. So, for example, one of the ones that we try to promote to patients is the HPV vaccine, as that can be a helpful one to prevent several forms of cancer, and as well as hepatitis B vaccination. Those have been shown to help reduce liver cancer. So there are vaccines that can help lower your risk for cancer. And again, I encourage everyone at home watching to follow up with their doctor to make sure their immunizations are up to date and which ones they might be suitable for. Great question. Thank you.
Thanks. Amber, the next one is for you. Does insurance cover genetic testing?
Mm-hmm. Everyone's insurance is a little bit different, but most insurances do. Genetic Center is in contract with the major HMOs and many of the PPOs as well, so yes.
Okay. So again, just to reiterate, if you have a question as to whether or not you're eligible for genetic testing, do call the Cancer Center, and we are certainly happy to put you in touch with Genetic Center. So our next question, Dr. Wagner, is for you. After that wonderful presentation, I'm sure we have a myriad of patients who want to make an appointment to see you. How do they get in touch with you?
Excellent question. I would be feel very fortunate to take care of anyone watching at home. So right now I'm practicing at the Midtown Medical Group Clinic, which is right next to Community Memorial Hospital, very conveniently located. And you could give us a call to schedule an appointment. The phone number there is 805-948-2841. Or if you prefer, you can log on to cmhshealth.org, the hospital website, and they have all of the clinic information listed there. And I'd be happy to see anybody there. Thank you.
Perfect. So Ember, our next question, are there any risks associated with genetic testing?
Genetic testing, because it's done through blood work and saliva, doesn't have any risk to us. It's really all just information.
Okay. Does it take a long time for results to come back?
Results are usually back within about a week to 2 weeks.
Okay, and who do the results go to?
The results will go out to the referring physician, and we also follow up from our office, calling out all the results to the patients as well.
Okay, that sounds good.
Mm-hmm.
So this next question is also for you, Ember. Is the cost covered by Medicare?
By Medicare, many times it is, yes.
Okay. So I believe that we are finished. That had to be our last question. Our time has come to an end. And again, I wanted to thank you both so very much for participating in this and giving such wonderful knowledge to our viewers. And just to reiterate a couple of the things that you said, there are some factors that you can change when it comes to your risk for cancer, and those are the factors you can change are the ones that Dr. Wagner addressed, and you can start by making little changes. You know, as the old adage goes, journey begins with a single step. So making small changes and building on that will certainly decrease your risk for cancer. And as Ember said, there are some factors we cannot change, and that's where genetic counseling and genetic testing comes into play. So if you have any questions at all regarding any of the information that was presented here this evening, please feel free to contact me at the Cancer Resource Center. And you can find that on this Community Memorial Health System website, as well as the slides that showed Dr. Wagner's information as well as my own. So from CMH Hospital, we wish you a wonderful evening and thanks for joining us.
Thank you.